Good afternoon, everyone. It's 1 o'clock on the button. We'll go ahead and get started. If you can please do roll call, Susie.
Yes, Chair Delgado.
Here.
Vice Chair Lucy is absent. Michael Brown.
Here.
Councilman Dare.
Here.
Dr. Danko is absent at the moment, but will be logging on via Zoom. Chair. Dr. Novak.
Here.
Dr. Clacking.
Here.
Chair, we have a quorum. And
Thank
for the
you.
record, it looks like Commissioner Lucy just logged on via Zoom.
Okay. Great. We'll close item 1. Moving on to item 2, Pledge of Allegiance. Sabrina, out there, you can lead us in the pledge, please. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Thank you. Moving on to item 3, approval of the agenda. District Health Officer, do we have any changes?
Yes, we're going to pull item 9D today.
Okay. We are going to pull item 9D off of the agenda. Can I have a motion on the remaining parts of the agenda? So moved. Have a motion, a second, all in favor?
Aye.
Any opposed? Motion carries. Item 4, recognition. District Health Officer.
Yes, thank you, Chair Delgado. Today, I'd like to begin with years of service and wanted to recognize Eric Lemon, Environmental Health Specialist with 5 years of service to the Health District. So congratulations to Eric. And also Susan Hopkins, Office Support Specialist, also with Environmental Health Services for 5 years of service. They're not here with us today, but we thank them very much for their service. And yes, they are on the screen. We have a couple of new hires also today, and we have Lorraine Fernandez, and I would like to ask Anna Heenan if she could introduce Lorraine. And Lorraine, maybe if you could come on up.
Good afternoon. I'm Anna Heenan, your Administrative Health Services Officer. I'd like to ask you all to join me in welcoming Lorraine. She's our new Fiscal Compliance Officer. She has a bachelor's degree in accounting and extensive governmental finance experience in managing multi-million-dollar budgets for both state, federal, and local dollar resources. So she's going to be a great addition to our team. She already has been wonderful. She's been here a little less than a month, and she's caught on like that. It's fantastic. So we're really excited to have her here. She's going to be assigned to the environmental health, community and clinical health services, and administrative health services. So she's going to be very busy. So welcome, Lorraine.
Thank you. I do have items on the board already, so please be nice.
Welcome. We're very nice. Thank you.
Thank you. And then we also have Liliana Ponce, and Lisa Lotritz is going to make an introduction for Liliana's Office Assistant 2 with CCHS.
Good afternoon, Lisa Lotritz, Division Director for Community and Clinical Health Services, for the record. I would like to have you welcome me in welcoming Lily. She is our new office assistant in our central clerical area, and she worked 10 years in the casino industry, and last year decided to make a career change so she could spend some more time with her family. And so she's very excited about being here, and she said that one thing about coming to the Washoe County Health District is that she has fond memories of coming here with her parents, with her mom, to get services. So now she's working here. Excited.
Amazing.
So we're happy to have her.
Welcome. Welcome. Good to see you.
All right. Next, I'd like to announce a promotion of Mary Cruz Schaefer from Public Health Nurse 1 to Public Health Nurse 2 in CCHS, and I believe that she's busy working. And we have a resignation. Christopher Peterson, who was serving here as a licensed engineer in EHS, has resigned. And we have also a transfer out of the health district. James Smith, Office Support Specialist, has transferred to our Human Services Agency here within Washoe County. And then I'd like to also recognize our Medical Reserve Corps volunteers. And we have had, amazingly, 659 different volunteers participate with us and assist us with our COVID-19 response activities, from their efforts in the earlier days to assist us with the testing operation and really ramp that up, and we're operating at a massive scale over the first year of our response, and then ramped up our vaccination efforts. And we're just scrolling through names here of the huge number of people that helped. We could not have been able to respond to our community's needs without these efforts, individuals that were donating their time and effort to us through rain and smoke and heat and snow and the flies from the rodeo. They just have done an incredible job for our community. So wanted to thank them and appreciate them. And I'd like to also turn it over to Dr. John Novak, who is one of our MRC volunteers as well, has donated a tremendous amount of his time. But I'd like for him to have an opportunity to make a few remarks as well.
Thank you, sir. I just can't say enough about our MRC volunteers. And these have been people, physicians, dentists, nurses, all kinds of EMTs, pharmacists, and everything that have stepped up on their own time, and most of them are volunteers. Lisa has been lucky enough to hire some of them per diem within the things. We've kept them within the health department, but there's an amazing group of people. And even this morning when we went through our exercise out there, there was a good number of MRCs that were there willing to step up and help us. And we couldn't have done any of this. And we've showed that Washoe County Health can really stand up an event, put on month after month, year after year in this case, of something that we've got to be proud of. And we've got people vaccinated and tested very efficiently and could have never, ever done it without our MRCs. So there is a recognition lunch going to be held, and I hope they all show up. So thanks all to the MRCs.
Chair, I got a good question.
Yes, please.
Are we given a certificate of some sort at this thing? Because I want to say how amazing it is. I mean, I know going there, I know without question John and his wife gave tons of time, but they were only 2 of the 700 almost people. And so when a community goes through things and it steps up, especially during this one, this was even antagonistic in many nature of what these guys did. And I think it's amazing. And so I just would, what more can we make sure we do that I don't know how to thank, but to say thank you.
Yeah, thank you for that question, Councilman. We have an event organized for April 15th, a lunch event that we've invited all of these individuals to. And it's an RSVP. We don't expect 659 people to end up showing up for that. But we are also preparing a certificate and a challenge coin for each and every one of them as an additional recognition and thank you for their service to our community.
Any further
Councilman,
comments?
have you seen the challenge coins?
No, sadly, I don't deserve one because I didn't get to come down, but I would love to
Well,
see it.
come in for your booster, we'll get you. No, they are absolutely spectacular designed and stuff, and I think this is going to be a memory piece for all of them.
That's awesome.
It's going to be well done.
Good job.
I can't wait to celebrate them and thank them in person. Of course, making sure we celebrate how amazing they've been. And I know they're not here today, but I appreciate just a round of applause for all of our volunteers that did such a great job. Thank you, Dr. Novak, and welcome to all the new hires, and congratulations to promotions, and good luck to those that have left us. We'll close item number 4. Move on to item number 5, proclamations. District Health Officers going down.
It looks like our first proclamation is going to be Youth Vaping Prevention Month.
Yes, thank you, Chair Delgado. I'll begin by reading the proclamation. And Lisa Schuritz is going to accept this. She's with our Community and Clinical Health Services Division. Whereas the month of March 2022 is Youth Vaping Prevention Month, and whereas the Surgeon General and the Centers for Disease Control and Prevention have both urged aggressive steps to protect our children from e-cigarettes, these highly potent, accessible, and addicting products that risk exposing new generations of young people to nicotine. And whereas the Nevada chapter of the American Academy of Pediatricians, the Nevada Tobacco Prevention Coalition, Parents Against Vaping, and the Washoe County School District are rallying around the goal of protecting our youth from the nicotine addiction, physical harm, and behavioral health damage resulting from youth using e-cigarettes. And whereas Washoe County Middle School youth e-cigarette use tripled from 6.6% in 2017 to 19.8% in 2019, and exceeds the Nevada Middle School e-cigarette use rates, which doubled from 6.6% in 2017 to 12% in 2019. And whereas locally and across the nation, there are unacceptable disparities in youth e-cigarette use by zip code, income level, and ethnic group. And whereas parents, students, and local organizations are engaging our community in health promotion by educating about the dangers of e-cigarette flavoring, advertising promotions targeted to youth, and ease of access and concealment of e-cigarette by youth. And whereas the Washoe County Health District looks forward to deepening youth e-cigarette prevention efforts through community partnerships with Washoe County School District, Boys and Girls Club of Truckee Meadows, the Children's Cabinet, and ACES Baseball, among others, to strengthen the public health and protect our children in Washoe County. Now, therefore, be it resolved that the Washoe County District Board of Health does hereby proclaim the month of March 2022 as Youth Vaping Prevention Month. Adopted this 24th day of March 2022. Oscar Delgado, Chairman.
Did you want to share any comments? Or?
No, I don't think so.
No? Okay. All right.
Well, let me give you a proclamation.
Thank you very much.
Congratulations. Thank you so much for all your hard work.
Did you want to vote on these after we do
Yes, we could.
Okay.
Well, let's vote now. Can I have a motion to accept this proclamation for Youth Vaping Prevention Month? A motion? Second. All in favor? Any opposed? Motion carries unanimously. Thank you. Item 5B, Proclamation National Public Health Week.
All right, and I don't know, Scott Oxford here? I think he's accepting.
Yeah.
Okay.
He's on his way down.
All right, let
He's
me begin.
waiting for his walk-up music. I don't know.
Whereas since 1995, the American Public Health Association, through its sponsorship of National Public Health Week, has educated the public, policymakers, and public health professionals about issues important to improving the public's health. And whereas U.S. life expectancy dropped from 2014 to 2017 in the longest sustained decline since the Great Recession, and only in 2018 began to increase again, U.S. life expectancy then dropped again in 2020 by a full year, which is the largest drop in life expectancy since 1943. Whereas there is a significant difference in health status, such as obesity, poor mental health, and drug use among people living in rural areas compared with people living in urban areas, and this variance increases because rural residents are often more likely to face social determinants that negatively impact health, such as poverty, transportation barriers, and lack of economic opportunity. And whereas a person's health status can differ drastically by zip code due to differences in the built environment, environmental quality, community context, access to healthy food, access to education, and access to health care. And whereas public health professionals help communities prevent, prepare for, withstand, and recover from the impact of a full range of health threats, including disease outbreaks such as the COVID-19 pandemic, measles, natural disasters, and disasters caused by human activity. And whereas public health action together with scientific and technological advances has played a major role in reducing and in some cases eliminating the spread of infectious disease and in establishing today's disease surveillance and control systems. And whereas preventable risk factors such as physical inactivity, poor nutrition, tobacco use, and excessive alcohol use are leading causes of chronic disease, and 6 in 10 U.S. adults have a chronic disease, and 4 in 10 have 2 or more. And chronic diseases cause 7 of every 10 deaths annually in the United States. And whereas the COVID-19 pandemic has illuminated and exacerbated racial and ethnic health inequities, now therefore be it resolved that the Washoe County District Board of Health does hereby proclaim the week of April 4th through 10th, 2022 as National Public Health Week. Oscar Delgado, Chairman.
Awesome, thank you. Scott, any words of wisdom?
You want to talk about what you're doing?
Thank you, Chair. For National Public Health Week, we are planning a press release that will be sent out pretty soon to the 4th, and a social media campaign outlining some of the actions that we've done and what we are taking to show not only appreciation for the staff that do this on a daily basis, but also to let the people know what's available out there in terms of services that we provide. So that's going to be a big component that we're going to focus on, and we're really excited about it.
Absolutely. Thank you so much. Appreciate that. Any comments from the board? Seeing none. Great proclamations. Can I have a motion, please?
So moved.
Second, all in favor?
Aye.
Any opposed? Motion carries unanimously. Thank you, Mr. District
Yes,
Health Officer.
Mr. Chairman, what would the pleasure of the board be? Would we like to take pictures today with
Yeah, let's do it.
People?
Let's do it.
Okay.
Let's come on down, you guys. Let's get back to the routine. Love it.
I dress nice. I don't know about you, Oscar.
Ooh, you're made with people. You would come next time and see where your seat is.
So why don't we try to go in the order that we were in? So we'll start with Lorraine.
We expect that same smile in 20 years.
Oh, no, it's always, we're good.
Anybody else want to see you with that?
I could.
right, that felt good. Feels like we're getting back to a little normal. Long missed that. With that, we'll close item 5, move on to item 6, public comment. Susie, any public comment?
We do not have any registered public comment, and I don't see any hands raised.
Okay, with that, we'll close item 6, public comment, move on to item 7, District Health Officer and Dr. Danko.
Yes, thank you, Chair Delgado. I'll start off with an update on COVID-19, and we're doing quite well in our community right now as far as numbers of cases that we have occurring. We're now reporting weekly on our dashboard, and for the week ending the 21st on this past Monday, we had 88 cases over the past week. So that's we're down to just over 12 new cases per day on our 7-day average. So very low levels. There's a lot of at-home testing that's going on, so we're missing some of the positive test results. But just looking back in time as far as our levels, the last time that we were this low was at the end of May in 2021, as we were coming down from that winter surge that we had over 2020. So it's been a long time since we've been down to these levels. We hope to see that continue. The hospitals are also in good shape with their 14-day average of daily average of COVID-19 patients in Washoe County standing at 12. Our CDC positivity rate is at 3.41%, so that's continuing to come down, and that's below that threshold level of 5% the World Health Organization has established. We're at the low community level under the CDC criteria, but there's a problem that's occurring with the CDC's webpage and reporting on community levels that's not unique to Washoe County, other counties in Nevada that's occurring with. It's happening nationally. So they're reflecting us at a medium level, and they're showing a much higher case count in Washoe County. And that's because they set their dashboard up, and it's web scraping. So it's pulling data from websites across the country and then using that to calculate what those numbers are. And we think that the change to the weekly reporting that we're doing is maybe a cause of the problem with the way those numbers are reported. But they are getting accurate reporting from our state that's flowing to CDC. So our numbers are the ones that I just reported to you, but the ones that CDC has are in the range of 280 per 100,000 over the last 7 days. So I just told you our 7-day was 88. So their numbers are not correct right now on their dashboard the way those are getting reported. We're continuing to report what our level is based on the CDC's criteria for establishing that level, and we're at low.
And our local media understands and knows that.
We have put out messaging regarding that with our social media platforms that our local media tracks. And the wastewater numbers that are the sampling that's occurring for looking for COVID-19 concentrations in wastewater are remaining low. We're watching for the BA2 variant, and to date, we have 5 cases that have been identified in Washoe County through genomic sequencing, so we're not seeing that increase in BA2 as being reported in other parts of the country and the world right now at this time. They're also testing wastewater samples with genomic sequencing. It's been a couple of weeks since I've seen updated results on those, but through that period, we hadn't detected the BA2 in wastewater samples here. And as far as our testing demand, we're continuing to operate our post for testing on Monday, Wednesday, and Fridays, but the testing demand is very low. And yesterday, we actually had a high number of people that came through to be tested, and that number was 24. So much, much, much lower than we've seen in the past. So everything's looking fairly good on the COVID-19 front, and we'll continue to monitor that as far as the levels in the community. Our vaccination efforts continue. We're offering the vaccine in our clinics. We're continuing to do community pods. We did a pod up in Gerlach, along with some other clinical services on February 28th. And we've got a pod and other health services that are being offered up at the Chateau in Incline Village next Tuesday, March 29th, in addition to events that we're doing here in the community. But the demand for the vaccinations has declined quite a bit. Our 4-week average of vaccines administered countywide through all the different providers is at 2,170 wide, 2,175. That's community-wide. And just for some comparison, at the end of December, we were having over 13,000 vaccines administered per week. So that's really, really declined. We're constantly messaging on the importance of the vaccinations, and particularly for people to get boosted if they haven't yet done so. We have 65.22% of our population that's 5 years and older that have completed their vaccinations. We have almost 70%, 69.8% of our 5 and older population that's initiated vaccinations, but only 27.7% of our population has gotten their booster shot. And the booster shot really improves the protection from getting infected, but also particularly from hospitalization and death from COVID-19. So it's very, very much encouraged for people that haven't yet gotten boosted to do so. And lastly, we do have treatments available, and people can access those treatments if they've tested positive through the state website, the nvhealthresponse.gov, and there's an 800 line as well that's available for people to seek those treatments if they've tested positive. So that concludes my update, and I will turn it over to Dr. Danko if she'd like to provide any additional information.
Sure, thanks so much. Can you hear me okay?
Yes, we can.
Perfect, thanks. I think, I echo what you said there, and to me, still very cautiously optimistic. And I think that's just because as a clinician, we've had multiple surprises with COVID before and with how it surges and the trends. With respect to the hospital and post-acute rehabilitation facilities, we do have multiple facilities in new COVID outbreak status as of this week in the Northern Nevada area, both encompassing Reno, Sparks area, as well as Carson City. So that certainly has thrown us for a little bit of a late loop. I think with respect to testing, we do have a lot of patients who are coming into the hospital that tested at home, did not test through any kind of a facility where there would be documentation of it, such as at the county. So instead, they had positive home tests, since those have become more readily available, particularly with the free test kit program. And I think I mentioned this last time and probably the time before, we're often seeing patients who, for example, tested positive at home, have now essentially recovered from that acute COVID infection, but now we're seeing tremendous complications from the inflammatory state that comes from having COVID, lots of blood clots, strokes, inflammatory conditions with the heart and lungs. So we certainly see an uptick in hospitalizations related to inflammation from prior or current COVID infection. So my clinical update would be still very cautiously optimistic moving forward.
Thank you, Dr. Danko. Any comments from the board for Dr. Danko?
I do want to have one comment.
Yep.
From being out in the trenches still vaccinated. We have seen a kind of an increase here lately on first-time doses, which is great. We're glad to see them, but they're starting to bring in a number of kids. And like last night, we were out to the library out off Pyramid, and we saw a good number of adult first doses with the idea, you know what, I probably should have done this before, and we agree and give them their first dose and get them scheduled for their second. But it's kind of a surprise, just this kind of late in the game that they're doing it, but they're still doing it. So we are encouraged and we're not quitting.
Good comments. I know I saw our team out there at Virginia Lake. You're locally doing vaccines. I saw a little line there that was formed for vaccinations as well. So that's great. Any other comments? Seeing none, thank you for the updates. We'll close item 7. We'll move on to item 8, consent items. Do any of the board members want to pull any consent items? No. Seeing none, any public comment, Susie, on these?
No public commentary.
So I'll take a motion for all consent items.
Move to approve.
Motion and a second. All in favor?
Aye.
Any opposed? Motion carries unanimously. Move on to item 9. Rimzo, 9A, review acceptance of Rimzo Health Operations Report. Mr. Dow.
Good afternoon, Chairman and members of the board, Dean Dow, President and CEO of Rimzo Health and CareFlight for the record. You have received copies of our report for February, and I'm happy to answer any questions that I can.
Any comments or questions for Mr. Dow on item 9A?
I just at large want to share, it's always good reading these, going through. At large, we have gotten to a place, I think, as a region, I want to just put on the record that we need to get in a room and make sure we talk about all kinds of dispatch and everything. And I know you've been having tons of conversation, a lot of needs, a lot of things we're talking. I know. And this has been happening since I actually got in office 6 years ago. And so with that said, I think we're at a wonderful place as a region that making group decisions is happening a little easier, a little better. And I'm optimistic. I know we don't always believe in optimism sometimes in government, but I do. And I'm one that believes that we can work together. And so I just want to put on the record that this whole conversation, all that needs to happen needs to be in a room, and let's put pressure on that. And I think the health board, we get to be, and I'd ask all of us to really understand, study it, look at everything from dispatch to EMC to how our firefighters are working together. All of it has to be looked at. And I don't know the answers. I don't pretend to know the answers. But I do believe having the right people in the room, and I think we're part of that room right here on the health board, and which would start pushing.
Great comments, Councilman. Any further comments?
I agree with him.
Okay. And I think there will be opportunities to further these discussions here in the later items of 9 and 9C potentially, with respect to item 9A. Any further comments for Mr. Dow?
I'll make a motion to accept those presented.
We'll tell you that's a motion. Second. All in favor?
Aye.
Any opposed? Motion carries. Well, acceptance of 9A, 9B.
Thanks for the statement, by the way.
Yeah.
And I'm not Alexia, so I'm going to sit down.
Yeah. Come on up.
We like Alexia a lot.
Yeah.
I get to share the good news. Is there an overhead still?
Yes.
Okay, thank you. Good afternoon, Mr. Chairman, members of the board, Alexia Jobson, Director of Public Relations for Rimzo Health for the record. You have for your review the public relations report for February. I do have a few more recent things to share with you though. Early in March, Rimzo Health hosted staff members from United States Senator Jackie Rosen's office. Organizational leaders and subject matter experts discussed with them how federal legislation related to out-of-hospital healthcare impacts our organization and employees on a day-to-day basis. We focused on topics that matter to our employees, including recruitment, retention, and reimbursement in those conversations with her staff. Rimzo Health and the Washoe County Health District are partners on encouraging citizens to download the PulsePoint app, which notifies app users if someone in proximity to them is experiencing a cardiac arrest. Is that better? Okay. A 30-day social media campaign launched at the beginning of the month. It encourages people to download the app and become a registered user, allowing them to react in real time and become a citizen superhero. If you haven't downloaded the app yet, please do. You can get more information at remzahealth.com/pulsepoint-respond. On March 2nd, Adam Hines, Rimzo Health's Executive Director of Integrated Healthcare, was invited to offer a webinar through the American Ambulance Association titled Casting a Wider Safety Net, What 988 Means for 911. This session provided a snapshot of the current impact behavioral health calls have on the nation's emergency healthcare system, as well as on ambulance service providers, the safety net healthcare provider, and communities across the country stand to gain from this systemic improvement to how people in crisis can access appropriate mental health care. Also, earlier this month, Jenny Walters, a senior education coordinator at Rimzo Health, and Noel, a high-fidelity birthing simulator in our Center for Integrated Health and Community Education, were featured on all 3 local television stations. The stories focused on how leading-edge technology such as Noel, who can bleed, talk, and birth a baby, create realistic scenarios. These scenarios are just one component of many things that set apart our paramedic program from others across the country. And finally, I'm pleased to share that the awareness campaign for our Assess and Refer protocol has launched across the community. Highlights from this include an article on This Is Reno, sponsored credit lines on KUNR, email communication to stakeholders and community members, and flyer distribution to social service agencies, physician offices, healthcare-related community resources, and frequent ambulance transport users. In addition, Adam Hines participated in a long-form interview on KTVN's Face the State about the importance of the public understanding and being open to how the 911 call is changing. I'm happy to answer any questions you may have.
Any questions, comments? Yes, Councilman.
Yes, it'd be great to see, with the work we're doing, any changes in 911, how often it's being used, seeing if what we're trying to do is even working. Do we have any of that information? Can we get that information just as we go?
Yes, certainly. I can work with our dispatch center to pull that. I think we're a little early in the campaign yet to kind of gauge that. But I do think as we see these things roll out, these initiatives roll out over the next few months, we'll keep an eye on if we're seeing a change in usage.
Yeah, if we could start just kind of see, some kind of chart, some kind of thing saying, hey, we're starting to see a difference, because maybe we even need to do more, a bigger approach or something. So thank you.
Thank you.
Any other comments? I will say that I saw Face the State with Ariana Bennett. Good job, Adam. Good job. I appreciated that, and it was good to listen about all the good work that's happening.
Great.
No other comments for 9B? Seeing none.
Thank you.
Thank you.
Ms. Jobson, can we get a copy of your flyer?
We'll close item 9B. Move on to item 9C. Discussion and possible request from Dean Dow.
Mr. Chairman, board members, Dean Dow, President and CEO of Rimzo Health and CareFlight for the record. Concerning 9C, what we're requesting, under the last 2 years in the pandemic and the emergency directives that were set forth by the governor, organizations like ours, hospitals, et cetera, could flex how they responded to patient care. With several different factors involved, obviously staffing and just call volumes, et cetera, hospital utilization numbers. And through that period of time, with the oversight and the approval of the District Board of Health, we were able to engage and start using a tiered system here within the county, also doing things like assess and refer within the county. With the understanding that at some point the governor's emergency directives would be lifted. And at that point in time, theoretically, those things would need to be addressed because they wouldn't fall under that emergency directive anymore. So what we're asking is, what we'd like to see is those programs that were initiated through the last 2 years. We have the Joint Advisory Committee that meets on a regular basis. We'd like to put those programs in front of them for their continued review, and then come back, I hope, in April, if their meeting schedule works, and present to the board what they believe is pertinent and useful and patient-centric and safe, and ask at that point in time that we look at amending the franchise so that we can actually continue those programs in the long run and long term, as opposed to having to, if you will, stop them and put them back up on the shelf.
Thank you, Mr. Dow. Comments from the board? Yes, Chief.
So, Dean. Mr. Dow, excuse me, looking at this, so you're talking about taking this to the Joint Advisory Board, but you mentioned Reno, Sparks, Washington County, Track and Meadows. Advisory Board would actually be representative of the agencies that are working with on this? Is that what you're?
The Joint Advisory Board's been meeting for quite a long period of time, and it's composed of all the responding partners as well as the EMS oversight group. We need to probably broaden that out now that we've got a new chief at the airport, and he clearly, I think, and rightly so, wants to see a larger role for the airport. So we'll get them involved in the JAC also. But that's the collective group, Chief.
Good, and I appreciate you bringing that up too, with the airport being involved because of their first response in the system. And then with that, I don't know, we just talked about it, looking at this from regional aspects. And, we've got these items here because of the declaration. But, as you know, I agree with you. Before the declaration, we ought to be looking at our services when it comes to the advanced program, BLS program, paramedic programs, and transport with all those. Should we broaden this to, say, the entire franchise because of the dispatch issues and everything else that are going to be coming up on a regional,
Chief, I would ask that we take care of the low-hanging fruit first. And I think those programs, I think the consensus over the last couple of years is that they work well, they're safe, they're patient-centric. Obviously, the three health systems participate in those and have seen relief in their ED utilization or improper ED utilization because some of these programs. So I think we can probably get this component done. And I think that there's been a massive amount of work, meetings, phone calls, et cetera, over the last couple of months in the sense of bringing everybody to the table relative to regionalization of the whole public safety, if you will, entity of the county. And where I would have been the first one to argue that maybe a year and a half ago, we would not have been able to get everybody in the room. It looks like today that window of opportunity is here. And so I'm very optimistic that that window is going to stay open. And here in the very near future, we're going to truly be able to get the right people in the room and have the right kind of level of discussions and get directive, if you will, from the electeds of where in vision, in the 50,000 foot view, they would like to see the region go. Because as you all know, we were created 35 years ago, now coming on 36 years ago. Fire departments obviously have a longer history in the community than we do. Hospitals, same thing. But the one thing we've all learned from the last 2 years in the pandemic is a need to change the system. And it's not an issue of there's any entity within the system that's not functioning properly, doing its job, et cetera, et cetera, et cetera. It's a fact that time has moved on. And we have not really struggled with this issue. Last time we struggled with it, I wasn't even here, but you were, and I think that was in 2013, 2014. But again, we need to evolve the system. The system needs to grow. It needs to change. It needs to be updated. And I'm very optimistic that right now we have sort of that unofficial, if you will, consensus that everybody agrees it's time. We've seen the need. And I would also argue that, and I've told this to a lot of people in the last few months, as difficult as those conversations are at times, and everybody has their protections, and God knows I have mine with my organization. We are blessed, I think, in this community right now to have the people that are involved in these agencies. Because as you well know, Chief, I get to talk to people all across the country every day. And everything from hospital leadership all the way through fire service and pre-hospital care leadership. And not many communities in this country are trying to deal with these issues. They don't want to deal with them. They're worried about dealing with them. They're worried about dealing with cost. They're worried about dealing with staffing issues, technology issues, et cetera, et cetera. So I would argue that we're very blessed that this window is here and we've got the people that are willing to get in the room and try to make things better.
Thank you, Mr. Dow. Question related to, if I'll follow up on the chiefs. I understand you're going to be working with the 3 other jurisdictions and so forth. You're going to be working with the other jurisdictions, correct?
Yes.
Looking at the motion here, and I, along with, I believe, the councilman and the chief, but it sounds like you guys aren't necessarily open to opening up the entire franchise agreement. You're looking at 2.3, and I get it. However, is there an opportunity for us to go back to those potentially most impacted by this, say the fire department, see if there's buy-in and everything else before we open, ask that you come and open this up? And if we
That's the process.
That's
Chairman.
the process is to open up.
The Joint Advisory Committee is made up of all those entities.
Okay.
And they're the ones that help plan this out through the last 2 years, some of the things we've done.
And so we'd go open
So
it
we
up,
go
we'd
back
have
to them.
conversations,
Yes.
we'd come back and say if there was buy-in, yes or
we
no
need
from
more
it.
time or et cetera.
Just District Health Officer.
Yes, thank you, Chair. If I could provide some additional clarification around this. In the interlocal agreement for our regional EMS oversight program, there's a provision in there that says if we are to make any modifications to the franchise agreement, that we have to have a concurrent review that includes Reno, Sparks, Washoe County, Truckee Meadows Fire, because they're a separate entity than Washoe County, and the health district involved in those discussions with Rimzo prior to any modification that's occurring. So that's why it's set up this way, so that there's that engagement and discussion before anything would come back to the board as far as a modification.
Okay. Yes,
Just
Dr.
a point
Novak.
of clarification. Are we looking under, with this one item, to open the franchise agreement to make these changes? And if we are, is this the appropriate, if we're going to open it for just one item, should we maybe not have the discussion on how we're going to make changes to the whole system in the future without going back and start nitpicking and doing pieces? I think I'd like to kind of look at the whole system. Are we going to go? And it's just a question, are we going to go to a regional system or something in between before we open that franchise agreement? Because to me, opening something like that, it's a Pandora's box in.
Mm-hmm.
Well, hey, on item number 3, let's change that to 4. Okay,
Mm-hmm.
So I have a question on that might help give some direction. So I'm not interested in moving forward to ease the pressure of what needs to be done, because I think I want pressure on to see us move and change. However, if this leads, is this the tip of the spear that pushes us into a concurrent meeting for all of these things, then sure, that's what we're asking for and we can help lead the way. However, if this is, and legal might even be able to help with this, I don't know, if this is going to lock us in like we said, oh no, this is moving off on its side, on its own, and we're just relieving pressure so we can still sit here for another 2 years and stare at it, then I'm personally going to say no to anything right now, to say no. We need to stop our dispatch. We have people we serve and they have to be served right. And so I've learned enough, I've seen enough, we've watched enough, and we have the right people in the room to make good decisions. So my ask is that if this is that tip of the spear that can guide us, then sure. So my question maybe to you, maybe to legal, is this going to allow that larger conversation, or are we just trying to relieve a little bit of pressure? Do you understand the question?
I understand the question.
Who best can answer that for me?
You want to go first?
continue to read for the record. The motion as written is clearly to advance that one piece related to these programs. With that said, that would be your motion. That doesn't mean that, the outcome or once conversations start, that it wouldn't open up further. That's my assessment, but looking at the four corners of the motion that is proposed, it would simply be for that one piece. You can make a different motion. However, that's my assessment of just the parameters of what's written here. As far as what might be intended, I think Mr. Dow is probably in a better position to have that conversation.
I think thank you. The intent of this is to be able to continue patient guidance activities with everybody's continued support. And that's it. And to do that, we do need an addendum in the franchise specifying that. To your larger question, Councilman, it is the tip of the spear. And again, I think everybody is at the table. Everybody has been communicating. And when I say that, I think electeds from both cities, the county, other decision makers, et cetera, have all been in the last couple of months engaged in some levels of conversations around regionalization. So to not to hold back and roll back, if you will, I think patient guidance initiatives wouldn't be productive in the scope of the whole picture. Now, as we move along in the conversations about regionalization, obviously having conversations that are not only operational and functional, but also patient-centric conversations have to take place. Because again, the 35, 40, 45-year-old model of call 911, regardless of what the clinical situation is, get a fire truck, get an ambulance, get the police department. Now you have 10 people on the front porch. And again, regardless of the clinical situation, our options is limited to put you in the ambulance, drive you to the emergency department, clearly is not the best for anybody in any community. So it's the concept of regionalization is going to be complex. It's going to be, I think, difficult at times to go through. But it's made up of pieces of finance, operations, technology, communications, patient guidance, so patient health activities, protocols, et cetera. So I would ask that we use this as the door opener, if you will, and continue to get energy around having the right people in the room to formulate and bring forward the larger discussion of how the system will evolve over time.
Councilman, thank you, Mr. Dowd. Councilman, what I'm hearing just for clarity is with this moving forward, Section 2 or Section 2.3 is going to allow for you to go and have a conversation with some of our jurisdictions to talk about this one item. We pulled item 9D off.
Yes.
Understanding that and with Mr. Adam Hines on the face of the state and what we're hearing across our region is that you guys need to come back to us for the conversation of a rate increase as well.
Yes.
And so I imagine that conversation is going to happen. In either case, we're going to have to open up the franchise agreement to have that larger complexity conversation. Is that correct?
Chairman, that's absolutely correct.
And so with this item moving forward, it's going to allow them to have a conversation. It may come back as a no, or it may come back as a yes from your jurisdictions, right, in terms of an approval. So I don't see us now moving forward on this item, supporting knowing that these regional conversations are happening. I think you hear from all of us that we want it to happen. And it really excites me, actually, that you're here finally, Chris, right? After all these years. And so I'm excited. We're all excited.
You show me the way.
And so, but without further pushing on this one, I think you guys can go forward, meet with our jurisdictions. It's not an approval, it's a conversation. You guys will come back to us with what that advisory group has said that they want to do. And then that way we'll vote on that at that point. But it won't push out the further regional conversation.
Mr. Chair,
Yes.
looking at just what his motion is, can we put the airport in this motion?
I believe we can.
Please.
Sure. So with that, any further comments? No? I have a motion on this, on item 9C.
Take a shot at it. So I move to approve the Washoe County Health District to coordinate a concurrent review with the Reno Sparks Washoe County Truckee Meadows Fire and Rescue Airport Authority, RFD, of Article 2 and 2.3 under the guidelines to open it and discuss with all partners and then bring back recommendation for the future.
Motion second. Further discussion? Seeing none. All in favor?
Aye.
Aye.
Any opposed? Motion carries.
Thank you.
Voice of God, Dr. Danko. Thank you. Item D was pulled off the agenda. Moving on to item 10. Presentation, discussion, Rimzo. Franchise compliance reports.
Chair, members of the board, I'm Andrea S., Public Health Preparedness EMS Oversight Program Manager. You do have my report on the Rimzo's franchise compliance from July 1 of 2020 through June 30 of 2021. Rimzo was found 100% compliance during this time frame. If you have any questions, I'd be happy to answer them.
Okay.
We spent
Any
a significant amount of time
questions,
reviewing.
comments? Tough ones. Explain.
Yes. Question, so just for clarity for anybody wondering, because we hear us talk about that we have a problem, we have things, we want to make sure people are there, and all of a sudden you get 100% compliance, people are like, wait a minute, what does that even mean? Because we obviously know that the hospitals were full, we know that so can you just make sure just for the public, because I know I understand what's happening here, that why is it that we can show 100% compliance even though we did not reach people in time, we did not do everything, how does that work?
Yes, I'd be happy to answer that question. So last spring, Rimzo did come to you and ask for a blanket exemption request. So what they asked for was to be exempt from any late calls during July of 2021 through the spring of 2021, sorry. So during that period of time, almost all their late calls were exempted as approved by this board. So that did impact their compliance on their response time, but that did end last spring. And so that may look different when I come back to present on their compliance for next year.
Great question. Any further comments, questions? Seeing none, we'll take a motion on this action item. Motion in a second. All in favor?
Aye.
Any opposed? Motion carries. Thank you. Mr. Vega, recommendation for appointment to the Air Pollution Control Hearing Board.
Thank you, Chair Delgado, members of the board. Francisco Vega, Director of the Air Quality Management Division, for the record. I believe the information has been included in your packet to take a vote on. I would just like to highlight that we did exhaust all opportunities to try to get people to apply for this position. We did a press release, social media post, sent emails out to thousands of email addresses, actually reached out to different organizations like AGC, NAIOP, things like that. And what you can see is we got 2 applicants, one of them obviously being the incumbent. So if you have any suggestions on how we might be able to get more participation on that, I'm definitely open to suggestions. But
I appreciate the amount of outreach we're doing. I know that's something that we've asked from the board, and thank you guys for doing that. You can only, get the horse to water, right? And so I appreciate you and working and reaching out to all those groups in our community. Yes, Dr. Novak.
Go ahead and make a motion on this.
Please.
Move to appoint Mr. Paul Kaplan to the licensed generally contracted position on the Air Pollution Control Hearing Board for a 3-year term beginning on March 28, 2022 and concluding on March 28, 2025.
That's a motion.
And I'll second with discussion real quick.
Second with discussion.
One, I think it's funny that you started the conversation with exhaust. I just wanted to point that out. Did you do that on purpose, Mr. Air Quality?
I did
That's,
not.
that's pretty funny. One of the things we do, and I know Reno does as well, whenever we have open spots, our city manager makes an announcement. I think if you got those to us because you represent our region, there's no reason that we wouldn't, I don't believe, also make that announcement in our meetings. And so whenever you have an opening, I would suggest that you get them to our city managers and let them decide what would be appropriate. But I think it would seem appropriate for our whole region to be a part of that. Thank you.
Thank you for the suggestion.
Good comments. I have a motion and a second. All in favor?
Aye.
Any opposed?
Aye.
Motion carries. Thank you, Mr. Vega.
Thank you.
See, stay there because we're doing 12A.
Thank you, Chair, members of the board. Francisco Vega, Director of the Air Quality Management Division, for the record. I did want to highlight one thing from my report, and that is the Scientific Advisory Committee has recommended to EPA to strengthen the national ambient air quality standards. So again, that's really drives everything we do in air quality. So strengthening those standards will mean more stringent permit requirements, things like that, and it will be more difficult to comply with those standards. So just wanted to kind of highlight that, and I'd be more than happy to answer any kind of questions.
Thank
I have
you.
a
Any
question.
comments? Yes.
Does that make us not in attainment at this point?
As of right now, we are in attainment. We would have, I believe, 3 years where we would collect data to demonstrate whether or not we're in compliance with those new standards.
Yeah, I think it'd be important I say that, I don't know, with them making that change, I think it'd be important for us to have a better understanding. It's something we talk a lot about, but I think even as a board and then into our cities, how that can actually affect economic development and really that push. It's something that I don't believe most people care about the word attainment, but you've taught me to care about it. So if I just think maybe at some point a better understanding for all, and then I honestly think our city should hear it, and I think Reno, because it really will affect some of what we're doing if we can't fix some of this, if they're really tightening up on that.
Yeah, thank you for that comment. The only thing I'll add is that, for example, I believe it was 2019 when we didn't have any kind of wildfires and things like that. For the ozone standard, which is currently 70, we were actually right at 70. And all indications point that in the future that standard will be reduced to probably 68. So getting back to your first question, it more than likely may impact our ability to attain the standard.
District Health Officer. To your point, Councilman, I think it's opportunities in terms of communication, especially with said organizations like EDON and so forth.
That's good.
We're trying to be, and we are doing a great job in terms of attracting, but along with that growth, there's impact to our air quality, and so how does that balance out? But you're absolutely right, and I don't know if we've reached out to EDON. It's an opportunity, a 5-10 minute conversation with that board to let them know. I know it's one of the reasons why Starbucks' headquarters is out in Minden, Gardenville, and not here because of the impacts of air quality that was going to bring here locally, and we weren't able to meet it. Correct?
Correct.
Yeah. So it's just things like that people just forget about sometimes. Further comments, District Health Officer? I know you had some.
If I just so the tightening of the standard is an implication of the recommendation that this scientific advisory committee has. So I think what Mr. Vega is doing is providing us with like a real kind of advance warning of a potential because they haven't published a proposed rule yet or anything further along on that lines. And this one is for the PM 2.5 standard. So it's basically very fine particulate emissions soot from burning. So obviously the wildfires impact us on that. And I think the other significant impact would be during the wintertime months with inversions that we have. And fortunately, with the wood stove program that we've had in place, a robust program for many years, we've made great progress with those emissions. And between that and favorable weather for air quality. Anyway, over the winters, the past few years, we haven't had to go to the red burn code, and I think we only had one yellow this past year.
That's correct.
Just Dr. Novak.
Would just a lack of not knowing how to approach this, at this time, since they have not issued new standards, would it behoove us as the health board to write them a letter and expressing our concerns and asking someplace in the new doctrine standards that there is a little more flexibility? Because from what I understand, there's about 11 cities across the country that's built into a bowl just like we are.
Right.
And they're probably every one of them facing exactly the same thing. And we can't do anything about it. So would it behoove us to write a letter? It might be, to me, kind of spitting in the wind, but might as well try it.
Yeah, I mean, it's a great point. It'd be a conversation too. The first things that pop in my head is we have several environmental groups here in our community that probably want to weigh in terms of whether we submit a letter as a waiver, or is that something, or are we not meeting and doing enough, right? And so it's the possible conversation in the community I can see on both sides if we're not touching base to provide a letter, not only from us, but from our community. So I see the business community, I see conservationists and folks wanting to weigh in, right? But yes.
If there was some thought of a letter, obviously, it's very strange for us to be at all affected by something we so don't control, like fires in another state. Right. And so that part, I don't think anybody would argue with, because we can do nothing about that. Now, the fact that we're in a bowl, that just, fun to be us, but I don't know that it means that we still have a responsibility to try to have healthy air. Right. And so I get your point on that. But the other piece of making sure that we have enough flexibility on the P2M88 thing he talked about, whatever that is. But that piece seems like that could be a definite look at. And I don't think there's no reason anybody should argue with that, because we didn't start the fire, and we didn't. Is that a song? I didn't start the fire. Yeah. Anyway. Yeah.
Can we push that back to our section to write such a letter?
Yeah. Do you feel like you've got enough from us to craft something, Mr. Vega, in terms of what we're hearing, or any guidance from you?
As the health officer stated, there hasn't been any kind of standards proposed. The recommendations, and again, these are recommendations based on scientific study, epidemiological studies, things like that. And again, the standards are meant to be protective of public health and welfare.
Right.
So those are just recommendations at this point. More than likely, the more appropriate time would be to when EPA presents those standards, then provide comment at that point in time.
Okay.
My concern there, I don't know, am I on? Yeah. My concern there is by the time it gets to the EPA boards that do this, is it going to be too late? Oh, we've already done all this work, we can't help it. To me, I'd like to get our input and our concerns that we can't help this. If you want to close off California for a while, that's fine, but we can't do anything about it. And we've always, since I've been on the board, we're sitting here on the edge of this. We were at 69 and 68.5, and then we're back to 70. I would just as soon write a letter of concern now while people are starting to formulate the process.
Yeah, there's usually an open comment period, right? And
correct.
Are we not in one?
Not at this time.
Not at this time?
Right.
Maybe at the next meeting you can provide kind of more of an avenue, or at least for us, to Dr. Novak's point, is maybe out of the window, we can maybe provide something if need be. Look further into that.
Absolutely.
Okay.
Good. Thank you.
Yep.
Thank you. That's any more on your updates there?
That is it.
That's it. Thank you for your report.
Thank you.
Appreciate it. Item 12B. Ms. Lauritz, how's it going? Come on down.
Lisa Latritz, Division Director for Community Clinical Health Services. I just have a couple of updates to my report. We found out yesterday that Greater Nevada Field, there was a press release that went out, that Greater Nevada Field will be going smoke and vape free. And
Nice.
Our chronic disease and injury prevention team partnered with Nevada Tobacco Prevention Coalition and Greater Nevadaville to help this come to light. So very
Great
excited
news.
about that.
Yeah.
So their opening game will be smoke-free.
Very cool.
Another update, just our divisional update is about TB Aware, World TB Day, and it happens to be today. So I just thought I'd highlight that. And the theme this year is Invest to End TB, Save Lives. So it's exciting. And one last thing, our Zero Suicide team finished their training sessions this last Monday. So our next step is they're putting together a letter to go out to all of CCHS staff, and then a survey will be going out for staff to take, and then they will regroup together and go from there to work on our implementation.
Good. Thank you. Any comments, questions?
I have a question.
Yes. Dr. Clark.
This is the, you hired 11 new people, I think you mentioned at a meeting last month or
different
previous
programs.
month. What's that?
Through our various programs.
Yeah, there was 11 people coming on for suicide, I remember. Was that for training? I
Oh,
remember.
that, they weren't hired. Those, what we did was each of our different programs, we asked that someone represent them so that we had someone from each, say, TB and family planning, everyone came together and brought a representative.
So it was internal, and then
Yes.
you had them trained?
Yes, yeah.
How did that go?
Very well,
Yeah.
yeah. So they again, they developed a letter, and that will be going out probably next week.
Mhm.
And then the survey, which I haven't had a chance to look at, but that will be going out as well to all the staff.
Great.
Yeah.
Good. Any guest, Dr. Novak?
I'm sorry to be kind of a pain today. I was in a phone conversation yesterday, day before, on where TB and sexual diseases, because they're kind of usually in the same departments, where people are standing nationally. Where are we standing nationally in both of those areas? Because there's big increases across the country.
Right. I just shared with Kevin when we met earlier this week, as far as where Washoe County is for
Right.
STIs, chlamydia, we decreased, I think it was 3% from last year. We just finished our 2021 numbers, so we were down 3%. Gonorrhea, I believe, was 6% decrease. Syphilis, we were up 33%. No, 20% for syphilis. Congenital syphilis, we were up 33%. Syphilis and congenital syphilis, Nevada ranks usually 1 or 2, so we're very high on that. The other ones off the top of my head, I don't know, but I can get you that
How about
information.
TB? Because that was in that same conversation I was in.
Yeah, I don't know where Nevada ranks or even Washoe County ranks for TB,
Okay.
but we are seeing, just lately, I think we're up to 6 active cases right now.
Yeah, well, it seems to go with that conversation
Yeah.
yesterday. Everybody is seeing huge increases all over the place. So.
Right.
Okay, thank you.
Any further comments, questions? Seeing none? Thank you.
Thank
for your
you.
report. Appreciate it. Ms. Dixon, come on. Environmental health.
Good afternoon. For the record, Erin Dixon with Environmental Health Services. I'd just like to highlight a few items from the report that you have in front of you. First, there's a detailed overview of the land development program that focuses on our septics, our residential wells, and our public water systems. Many people are unaware that there are approximately 18,000 residential septics and 9,000 residential wells in Washoe County. And this team is responsible for reviewing, inspecting the installation, demolition, and repairs for both of these systems. Often our team is educating homeowners that are not familiar with the regulations, as wells and septics are not the hot topic that many people know about until there's an issue. And our team is very proud of the fact that they are available to the homeowners when there are questions. Also, I want to provide an update on the town hall meeting I mentioned last month. Our temp food team, along with support from many other individuals at the health district, held an unpermitted food vendor town hall meeting. It was held in this room, primarily in Spanish, to answer the community's questions on why food permits are important and the steps to obtain one. Thanks, Chair Delgado, for participating and lending your support. It was a collaborative event with the City of Reno presenting information on business licenses, and other jurisdictions provided information as well. Multiple documents were developed primarily in Spanish, translated also into English, and shared to help answer questions outside of the town hall. So those documents are now available for the rest of the community as well. There were approximately 25 community members present in person, and significantly more participated online. So we are really looking forward to ongoing outreach and education in the community, as unpermitted food vendors continues to be an area of concern.
Great.
So that's it, if I have any questions.
Any comments, questions? No? Again, thank you to your team. As Dixon and I have heard, got a lot of good feedback, so continue the good work on the outreach.
Great.
Appreciate you guys doing that.
Yes, and thank you again for participating.
We'll close item C. Item D, Dr. Dow.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I don't have anything to change or add. There is one highlight. So in public health preparedness, I do want to highlight the 3-day emergency preparedness exercise that's happening this week. So Tuesday, Wednesday, and today. The Inter-Hospital Coordinating Council, in collaboration with our Public Health Emergency Preparedness Program and along with State Division of Emergency Management, have been working on with all regional partners since September of 2021 to coordinate the planning piece of this exercise. The scenario being played is an explosion of a bomb with radioactive content at the Northern Nevada Sierra Medical Center, and the plane crash also happened at the Reno airport. So this is a full-scale exercise that took place at multiple locations in Washoe County, utilizing multiple regional as well as hospital and EMS plans. Regional plans that were activated included the Washoe County Health District Emergency Operations Plan and its various annexes. So we provided health unit coordination throughout the exercise, and because this exercise involves a radioactive explosion affecting the public, Washoe County Health District exercised the operation of a full-scale community reception center stood up this morning, designed to provide first aid, population monitoring, radiation assessment, and resources and countermeasure distribution to the general population. So various partners, responders, hospitals, all participated in different areas of this response, and with different exercise objectives played into this. So it's immensely beneficial when we have these exercises like this, because it helps establish and maintain a unified and coordinated operational response, and to integrate all critical stakeholders and establish awareness for all in such an incident. So lessons learned during this exercise, we're going to capture this to support the update of our Washoe County regional plans and for educational purposes, and to identify gaps that may need to be addressed in the future. So that's all my update. I'm happy to answer any questions you may have.
Any comments, concerns? I will say that did a great job communicating to just the region and our community and media. I know, unfortunately, we have some other world activities taking place, and there was some sensitivity to that. However, the communication that went out to the general community that this is an exercise, and it's to our benefit to move forward. I thought you guys did an exceptional job, so thank you to the team. And from what I've heard, it's been a great show, and so thank you. Further comments, concerns, comments? No, thank you, Dr. Dow. Appreciate it. District Health Officer.
Yes, thank you, Chair Delgado. And if I could just add, I think the best quote I heard was from Andy Ancho, the Reno emergency manager, said the last couple of days that we've put people way outside of their comfort zones with this exercise, and that's a great learning opportunity.
Right.
So for my monthly report, I want to highlight the meeting that I had on March 1st with the city and county managers on our FY23 budget. So Mr. Kreutz, Mr. Thornley, Mr. Brown all attended. And this is one of the requirements of the interlocal agreement is to have this annual budget meeting with the managers. So I included the summary in my report, but I'll just go through the major comments or discussions with the managers, and largely led by Manager Brown, questioning about whether the health district had a recommended fund balance. And while we don't have our own policy on a fund balance, we try to follow the Washoe County policy of a fund balance in the range of 10 to 17%. And that's why we have the budget that's in deficit spending over the coming year and through the next several years to, at the end of FY26, get us into that range of 10 to 17%. So we're spending in a more sustainable and strategic pattern rather than spending everything and not having a sustainable path forward if we spend everything in a short period of time. We discussed the health equity funding and the positions for health equity that we've added with that grant over the past year. And Manager Brown inquired about whether health equity included the communities of Gerlach and Incline Village, and it certainly does. We'll continue to work with those communities. I mentioned we've had a pod and other clinical service events in Gerlach last month, in Incline next month. And I actually traveled up to Gerlach with Manager Brown last Thursday to meet with some of the representatives of the Burning Man organization around some of their ambitions around some development in the Gerlach area up there. And then we also had some discussion about the deputy health officer position and how we had set up the class specification, what we were looking for qualifications for that position. And it's quite similar to the class specifications for the assistant county manager positions here in the county structure, but looking for adding a master's in public health to the educational attainment list, in addition to looking for MBAs and masters in public administration. There was some question about, so how does this compare to the way Southern Nevada Health District has their organizational structure? And we differ a little bit from the Southern Nevada Health District because they are an FQHC, Federally Qualified Health Center, and provide more primary care clinical services there. So we have not gone down that path because we recognize the excellent work that's being done by Community Health Alliance and Northern Nevada Hopes here in our community. And we don't see that need as was seen in Southern Nevada. So we're a little different, and they have a health officer, a chief medical officer, and they also have a position that is over their community health efforts. And so we're a little different in that structure, but we're looking to have a health officer and a deputy instead of sort of those three principal positions that they have. And then I think the last area that was significant that came up was around our training budget, and we had identified that we had about $45,000 that was in the Office of the District Health Officer for our district-wide training needs. And there was a question about, well, is that sufficient? And on its own, it's not. But we explained that we have that for the district-wide sort of training needs. Each of the divisions also has a budget for their own division staff for the type of training they need for those program areas. So our overall training budget is actually just a little over $300,000. And then we're also relying on other training programs that the county provides, utilizing those that they provide for supervisors and other areas. So that was the discussion. No real concerns that were noted at all over the budget. I think everybody was satisfied with the approach that we're taking. And then also I just would like to highlight that the work has begun under Senate Bill 209 that passed in the last session, and this was to look at how the state responded to the COVID-19 pandemic and to assess what went well, what didn't go as well, what can we learn from this, and also what should we be doing to support public health and have a better public health in Nevada. And so we responded to a survey that was sent out by LCB and also participated in a statewide discussion with Senator Donato on those topics. And so I had an opportunity to provide some input there also with the Carson City Health and Human Services, Southern Nevada Health District, the Nevada Association of Counties that was representing rural counties on the call, emergency managers from the larger counties, governor's office, and DHHS. So those are my highlights from my report, but I'm happy to answer any questions.
Any comments?
I have just one.
Yes,
If they're ever interested, I think that should be sent out to all of us elected officials, that particular survey. And I think we all have a lot of answers, good and bad. But I think if we're going to learn from what we're doing, I think it'd be important to catch the people who get to be right there on the ground working with everybody, the actual effects of decisions been made. And if you'd share that with them, then my concern is that I appreciate what everyone does, and not that you guys don't have hands-on, but we get the calls, we get all of that. And so, setting all politics aside, we are just looking at what's caring for our communities, and I'd like to give an opinion in there, but I'm sure I'm not the only one. Only to learn. None of this is going to change anything in the past, but if we have to face something again, I would like to give a few things that I think would help us all.
We can certainly pass that along.
Thank you.
Good comments. Anyone else? Seeing none, we'll close item E. Move on to item 13, board comments. Comments from the board?
I do have a comment. Being out in the Hitherland again today, I do have to commend what our health department has done, continues to do. It was a great exercise all the way around. The optics could have been horrible. They turned out to be good. The response from all the people internally, our people that, especially Stephen and Wes, that helped plan this thing, and a few other people that have been working on this for months. For an exercise like this the first time around, I can't see it going much better. Did we learn some things? Absolutely. We made some suggestions to change positions, do a few things, but if we had to stand up something like this tomorrow, which I hope we never have to do, it really worked well for our first attempt at it. So thanks to MRC and our own staff. We did it again.
There you go. Thank you, Phyllis Cox. Anyone else? Seeing none, we'll close item 13. Can I get a motion to adjourn?
So.
Motion second, all in favor?
Aye.
Aye.
Motion passes. Have a good afternoon, everyone. Thank you.